everyone. Thanks so much for joining us today. I'm Kiera Butler, Senior Editor and Health Reporter at Mother Jones. More than a year into the pandemic, it seems like a return to normal life is so close we can almost touch it. The vaccine rollout has really picked up pace in the last few weeks. 1 in 6 adults has now been fully vaccinated against COVID-19. I myself am elated to have received my first dose just 2 weeks ago. At the same time, we're hearing more about dangerous variants that could cause another wave. And we know that some vulnerable communities in the United States still don't have great access to vaccines. It's hard to know what to expect in the next few months. I cover this and I find myself reeling from all the news. Will we get to hug our loved ones and send the kids back to school? Or will we see a nightmarish new wave of disease? We know you have a lot of questions. So here to help us make sense of this tenuous situation is Dr. Peter Hotez, a professor of pediatrics and a vaccine scientist, and the founding dean of the National School of Tropical Medicine at Baylor College of Medicine in Texas. Dr. Hotez has worked on the development of many vaccines, and during the Obama administration, he served as a U.S. science envoy working on vaccine initiatives in countries around the world. Since the start of the pandemic, Dr. Hotez has been incredibly busy. If you watch cable news, you might recognize him from CNN or MSNBC. He's been on The Daily Show, and this brave soul has even set the record straight on Fox News. Throughout the whole thing, Dr. Hotez has been especially adept at reminding viewers how politics has shaped the course of the pandemic. He was one of the first to connect the anti-science bent of the Trump administration to the rapid spread of misinformation about COVID-19. Dr. Hotez's new book is called Preventing the Next Pandemic, Vaccine Diplomacy in a Time of Anti-Science. Today, we'll talk about the whole idea of vaccine diplomacy and how forces like political instability and climate change make our world increasingly vulnerable to infectious disease. We'll talk about some of the latest science on the pandemic, the race to vaccinate the population before worrisome variants can take hold. And of course, we'll answer your questions. Wherever you're watching this, please leave a question or comment, and we'll save some time at the end to answer those. Dr. Hotez, welcome. Oh, I can't hear Dr. Hotez. Yep, that's better.
Sorry about that.
Okay.
A little red light went off on the microphone. I'm not sure what was happening there.
Well, as I was saying, welcome. Thanks for joining.
Thank you.
You have been working so hard for the last year. How are you holding up?
Good. It's been crazy getting up 4 or 5 in the morning, and oftentimes Zoom calls with our collaborators in Asia that we're accelerating a vaccine for, or in Europe, or early morning New Day interviews on CNN, or going to bed at night late because of late night talk shows or other calls with Asia, starting with Asia, finishing with Asia, early morning, late at night. So it's been a challenging year. It's an exciting year also. I mean, I got my MD and PhD to make a difference in the world, and been working on, in addition to vaccines for neglected diseases, we've been working on coronavirus vaccines for the last decade, back when nobody cared about coronavirus vaccines. So it's good to being able to make a scientific contribution, and it's I feel privileged to be able to use my expertise to making a difference in the world and explaining the science to general audiences. So it's been scary, it's been exhausting, but it's also been quite meaningful as well.
Well, we're so lucky to have you here to help us make sense of some of the science today. So I want to start by talking about 2 topics that are on a lot of people's minds: vaccines and variants. Despite a swiftly moving vaccine rollout, after months of decline in cases, we're beginning to see some small upticks in some places, and we're hearing that variants are becoming more widespread. In the war between the vaccines and the variants, who's winning so far?
Well, it could go either way. We're kind of at a tipping point. And the good news is we are starting to vaccinate the American people. We're up around 25% of the U.S. population that's gotten a single dose of vaccines. And, the Biden administration came out with a plan right after the inauguration saying they were going to do 100 million immunizations in 100 days and vaccinate the American people by the fall. But then we saw this B.1.1.7 variant coming out of the United Kingdom, and we knew from studies conducted in Europe, out of Denmark and the UK, that this virus is more transmissible than anything we've seen before, and about 60% more transmissible, and higher mortality. That's a paper in Nature. And higher hospitalization. A paper came out of Denmark. So, what we advised the Biden administration, the scientific community, was great plan, but you're going to have to go back and redesign this, because we need to get the American people vaccinated much earlier if we're going to get ahead of this variant by summer, late spring at the latest. And they did. They put forward a new plan. They procured more vaccine. They listened to the scientific community. So the good news is I think we're going to be in good shape by the summer, partly because the vaccines seem to work just as well against the B.1.1.7 variant in the UK as the original lineages, so that's great news. And also now we know the performance features of these vaccines, at least some of them, that they not only interrupt symptomatic illness, which is what we knew from the phase 3 trials, but from the real-life situations in Israel and Scotland, it shows they actually stop virus shedding from the nose and mouth and actually block asymptomatic transmission. So it means by the summer, I think we could potentially vaccinate our way out of the epidemic. That's the good news. The not so good news is this B.1.1.7 variant is accelerating in Texas, Georgia, and Florida, and up in Michigan, up in and in New York and New Jersey. And that's really worrisome, and the numbers are now moving upwards in Michigan and New York and New Jersey. And so this could go either way at this point. If we can continue to vaccinate, if we can convince some of the governors to hold off on relaxing mask and social distancing restrictions, I think we can keep us at a flat level. If we don't, then the numbers are going to start to go up and we'll see a fourth wave. And it's sort of precarious right now. Everyone is remarking on the fact that we've gone from 250,000 new cases a day to 50,000 new cases a day, and that's great. That's an 80% decline. Those are confirmed cases. But keep in mind that those numbers are a fourfold probably underestimate. So the real numbers are much higher. And that's still a high level, even that 50,000 number. That's the level we were at last summer when we were all wringing our hands that everything was falling apart. So we feel good that it's gone down 80%, but it's still a screaming high level. And so we're at a very dangerous time right now.
So before returning to the variants themselves, you mentioned the research out of Israel about transmissibility. Now, the official line from public health officials here has been that we can't assume that vaccines prevent transmission and that we should behave as if they don't. Do you know when we can expect to have more data on that and clearer guidelines from our leaders?
Well, the numbers look pretty good from Israel. It's a little hard. If you look at the New England Journal of Medicine paper, it came out last month. It clearly it confirms the high level of prevention of symptomatic illness, 94-95% as advertised from the phase 3 study. But then they also looked at PCR positive documented infection, and that was about as good. And when you looked at the subgroup analysis in the supplementary tables, over 90% against asymptomatic transmission. So I think it's looking pretty good. I think what you're seeing is the CDC, the Centers for Disease Control, would like to see additional studies like that before they really give a version 2.0 of guidance around what to do after you're vaccinated. So if you remember, about 2 weeks ago, they issued interim guidance on what to do if you're vaccinated, and that you can sit in a room with other vaccinated people, or if you're a parent or grandparent, you can visit with a single household and see your kids and grandkids. But they kind of held off on travel. They held off on going to restaurants, and some of my colleagues were quite critical of the CDC that they were so conservative given what we knew. But I think what the CDC did made sense with the B117 variant. You don't want a lot of people traveling all over the place. And I think they just wanted to see other confirmatory studies. And I believe that by the summer, we'll see version 2.0 of those guidance recommendations, what to do if you're vaccinated. And I think we'll liberalize quite a bit. So we have a lot to look forward to. It's a matter of hanging on these next few weeks.
We're hearing that some variants, such as the P1 variant that's dominant in Brazil, may not be vulnerable to the vaccines that we have. What's your sense of that?
Well, when you looked at the B117 variant, I don't want to get too much into chemistry, but that's a consequence in the spike protein of what's called an aromatic amino acid substitution that causes tighter binding of the spike protein to the receptor, and that's likely translating into higher transmissibility and higher virus replication and therefore higher mortality. But the vaccines still work. So the antibodies to all these vaccines work by inducing virus neutralizing antibody. They still can manage that amino acid substitution in the B117 variant. The problem that you get in with the Brazil variant, the P1, and the South African, the B1351, if I'm not driving you all crazy with the numbers, is that those virus neutralizing antibodies don't neutralize as well. So the virus neutralizing antibody titers go down, and that translates into decreased effectiveness. They can still partially protect, likely, but not as well. And we have two examples where we've actually looked, because the J&J vaccine and the Johnson & Johnson vaccine were both the Novavax and the J&J vaccine were both tested in South Africa and shown to be partially protective. So that does worry us about Africa and Brazil and therefore Latin America. But those two variants are not here in a big way right now in the U.S. And when I've spoken to some of the virus genomics experts, like my colleague Trevor Bedford, they seem to feel that the UK variant is going to be the dominant one for the foreseeable future in the U.S. So all the vaccines should protect. But what that means is that later on, as we start seeing big declines in transmission, we still have to be wary of the South African and the Brazil variant. And therefore, don't be surprised if later on this year or into next year, we all wind up getting another booster. So if you got 2 doses of the mRNA vaccine from Pfizer or Moderna, you might get a third immunization. And if you got a single dose of the J&J vaccine, you'll get a second immunization. And that will serve multiple purposes. One, it'll increase your virus neutralizing antibody titers even higher. So it increase the likelihood of cross protection, create more durability of protection. And those boosters will probably be designed and to reconfigured a bit to be more specific for the South African and the Brazil variants, which are quite similar. And I think that may do it. My hope is that there's enough convergence around the variants that we won't be repeating this every year like we do for a flu immunization, that we might, after that third immunization, we might be done with this for a while. But we'll see. We'll see how that progresses. The bigger issue is, we're running out of options for Africa and Latin America, and we can talk about that.
Briefly about the Astrazeneca vaccine that's been under some scrutiny these last few days. There were reports first that the vaccine had caused blood clots. Then we heard that it didn't. Now we're hearing that AstraZeneca may have used out-of-date data. Just yesterday, there was a report that Dr. Fauci called this an unforced error. What is going on here, and how can we prevent scientific errors like these from undermining vaccine progress and vaccine acceptance?
Well, the way I describe this is, the big vaccine producers are not really in this in a big way. I mean, historically, the 3 largest vaccine producers have been Merck and Company, GSK, and Sanofi Pasteur, and they're not right now. They're not in a major way. Merck is going to help out. Merck and Company is going to help out with the defense production through the Defense Production Act. They'll help out with making one of the adenovirus vaccines, I believe the J&J vaccine. So the companies that are in it right now, Moderna, AstraZeneca, are not really vaccine companies and at all, and so they're new to this, and I think there seems to be a lack of understanding of how public perception can quickly derail public confidence in a vaccine, or as I like to say, it doesn't take much to vote a vaccine off the island, even if it's a good vaccine. And I worry what's been happening lately with AstraZeneca. I mean, it started out rocky with, if you remember, the CEO. You know, he was taped talking about a transverse myelitis case to his J.P. Morgan shareholders. That was tone deaf. And then you had your individual European countries suspending the vaccine because they were concerned about blood clots, and then the European Medicine Agency, the EMA, walked it back and said, no, it's fine. It's no higher than we would expect in the general population. And then you had this debacle in the last 2 days around jumping ahead of the Data Safety Monitoring Board, and all that is all that's cumulative and will erode confidence. And in the U.S., you know, we've got they've procured so much vaccine that I think, you know, even if public confidence in the AstraZeneca vaccine is not high, you know, even if the FDA finally does release it under emergency use authorization, it may not have that big an impact. The problem is that I see is in Africa and Latin America, we don't have a lot of options. You know, with look at the enormity of the scale. We're looking at 1.1 billion people in sub-Saharan Africa, 650 million people in Latin America, 2 doses of each vaccine. We're looking at 3 to 4 billion immunizations that we have to do. And we know the mRNA vaccine technology is still new, and you're not going to get that kind of scale out of the mRNA vaccines, at least not now. So, you know, Pfizer BioNTech donated 230,000 doses of their vaccine to Rwanda, and that's great, you know, through the COVAX facility, but it's a drop in the bucket. And the J&J vaccine is having some production issues in terms of scale up. We still don't have a lot of doses of the J&J vaccine. Novavax, you know, may be similar. So when you go down the list, you realize there's not a heck of a lot out there for Africa and Latin America. So the AstraZeneca vaccine was the workhorse one we all expected for Africa and Latin America. And if public confidence is eroding in the U.S. and Europe, we know what happens. It translates pretty quickly now to Africa. I mean, you know, when France suspended the use of that vaccine, and immediately, I'm sure it had a very detrimental effect in Francophone Africa that takes its cues from France. And so I'm quite worried about this. I mean, we are accelerating our own recombinant protein vaccine. It's an older technology that uses the same technology as the hepatitis B vaccine that's been around 4 decades. It uses yeast fermentation technology, and hopefully ours will get up. We're partnering with Biological E and Hyderabad, India. They're one of the big vaccine producers, like Serum Institute of India. They have capacity for making 1.2 billion doses, and so that's exciting, and hopefully ours can play a role. But we're going to need that AstraZeneca vaccine for the LMICs, and I'm quite concerned.
So this is actually a great segue. I wanted to talk a little bit about a concept that you write about in your book, vaccine diplomacy. Can you explain that concept?
Yeah, it has to do with the fact that vaccines are so powerful in terms of their impact on public health, and therefore everything that goes along with it, that the technology has enormous ramifications for foreign policy. Like, for instance, when Edward Jenner developed the first vaccine, he was called upon to mediate prisoner exchanges with the French during the Napoleonic Wars, and Thomas Jefferson brought vaccine over to give to Lewis and Clark in their explorations in the wilderness as a goodwill gesture for Native American populations who were being decimated by smallpox. And that's continued, that thread of how vaccines are used as instruments of foreign policy continued with Albert Sabin, who developed the oral polio vaccine. Not many people realize he did it jointly with the Soviets at the height of the Cold War. He got permission to send his polio strains to the USSR. His counterpart, Dr. Chumakov, and others scaled up production, tested on 10 million Soviet school children, was shown to be safe and effective. And this was right after the Sputnik launch, one of the worst times in the Cold War, the two countries putting aside their ideologies to work together to develop a life-saving vaccine. And this was done, a similar partnership happened for the smallpox eradication. The Soviets had figured out how to freeze dry the vaccine to make something called Dryvax that allowed people to carry smallpox vaccine all over the world without refrigeration. So there's this historical thread of partnering between nations, and I tried to resurrect that when in the Obama administration I served as U.S. science envoy 2015, 2016 for the Middle East and North Africa with Muslim majority countries. And that was a great opportunity because there are no vaccines made in the Middle East and North Africa. Actually, there's no vaccines right now made on the African continent. So the idea to build capacity, I think, was very powerful, and that's one of the major themes in the book. And I worry we've gotten away from that now because there's been this erosion in the governance around vaccines. What you've got now are the Russians and the Chinese are not going through normal regulatory mechanisms, stringent regulatory authorities in the U.S. or Europe or WHO, World Health Organization pre-qualification mechanisms, and instead doing these kind of one-off bilateral relations with countries in a very transactional manner, and with providing vaccines of uncertain in terms of quality control and quality assurance. And I think that's very dangerous. So we have to figure out a way to bring this back. And a component of that is also rebuilding or building capacity for vaccines in Africa and Latin America, in the Middle East. I think there's an urgency to do that because we've seen the default plan is to rely too much on the multinational companies who are going to produce good vaccines, but not necessarily vaccines that are suitable for resource-poor nations in Africa and Latin America and elsewhere.
Let's talk a little bit about the role that anti-science movements play in all of this. There's long been an undercurrent of this in the anti-vaccine movement, but you write in your book that the culture of misinformation has really taken hold in the last few years in different parts of the world. Can you say a little more?
Yeah, unfortunately, this has become a powerful and very damaging force. And Kiera, the two of us have been speaking about this all during 2020 and into 2021. And the anti-vaccine movement has a thread throughout American history, but in its modern form, it took off starting in the late 1990s after a publication of a paper that was shown not to be valid by Andrew Wakefield and his colleagues in London, claiming that the measles, mumps, rubella vaccine had the ability to cause autism. At that time, they called it pervasive developmental disorder. The paper was ultimately retracted after an investigative journalist from the Times of London wrote a series of articles named Brian Deere, but it didn't get retracted till 2010, and this gave an impetus to ignite an anti-vaccine movement, which really accelerated in the U.S. And then it took this odd turn starting in around 2014, 2015. I had spent a lot of effort debunking the false claims because they would keep on moving the goalposts. First, they said it was the measles, mumps, rubella vaccine that did it. Then Robert F. Kennedy Jr. said, no, it's thimerosal preservative. And then it was spacing vaccines too close together and alum in vaccines causing autism, and it was all garbage. There was no evidence for any of that. And so I spent a lot of time going through the scientific literature, and the scientific community responded each time, and also talking about what autism is. And because I have a daughter with autism and intellectual disabilities, and I wrote this book called Vaccines Did Not Cause Rachel's Autism that also reports how autism begins in early fetal brain development through the action of 100 genes, and how we did whole exome sequencing on Rachel and my wife and I. So all of that, I think, had a positive impact in kind of tamping down the fake assertions of the anti-vaccine lobby. But then they re-energized in an odd way that I could not have predicted. And starting in 2015, they aligned themselves with the Republican Tea Party. So sort of political extremism on the right, especially in Texas and Oklahoma, under this banner of health freedom, medical freedom, saying, no, you government can't tell us what to do. So it had gone from fake medical assertions to now this politicization. They created political action committees like Texans for Vaccine Choice, and very aggressive in lobbying the state legislature. And over time, it's shifted from sort of the far right of the Republican Party to a mainstream platform of the Republican Party. And we saw that play out in 2020, where they glommed on protests not only against vaccines but masks and social distancing. So this became a full-on anti-science movement with deadly consequences. People, as COVID-19 came into the southern states last summer, you had both governors and lots of people defiant of masks and social distancing. And then it took off. Then you had the Sturgis rally, if you remember, later in the summer or fall. And then that led to that big surge in the upper Midwest. And you had the terrible, awful story of that was well publicized, of the ICU nurse, who wept as she recounted the story of her patient calling COVID a hoax as his last dying word, so he couldn't even die with dignity, and that was very powerful. And now we've got multiple surveys, the latest one from the PBS NewsHour with NPR and Marist, showing that white Republicans are overwhelmingly the most vaccine hesitant group. And people are asking, hey, where did that come from? Where it came from was exactly what I just described. Coming out of 2015, you had this, it started out as an anti-vaccine group linked to the Tea Party under Health Freedom. And it's growing. Now you've got multiple members of the U.S. Congress saying they're not going to get vaccinated. You have this high rate of hesitancy. And it's not just the NPR PBS NewsHour poll. It's also, we did a study in collaboration with a group at Texas A&M that was published in Social Science and Medicine. Then you had the Kaiser Family Foundation with their poll, all pointing to the same thing. And it's globalized. So last summer you had these anti-mask, anti-vaccine protests that were in European capitals, London, Berlin, Paris, that were reported by the New York Times, BBC, and other news outlets as linked to QAnon and far right-wing political groups. And then, and this, if that weren't complicated enough, you've got now the Putin government. This has been reported by U.S. and British intelligence, launching this whole program of what's being called weaponized health communication that's filling up our internet with anti-vaccine, anti-mask disinformation. And so this is a full-on empire now. It's, my belief is that this, and I don't know what you want to call it, an empire or a confederacy, but it's very powerful. It's very well organized. It's well funded now. You've got right-wing think tanks now endorsing it, and the consequence is that this is leading to deaths. Right, the reason why COVID-19 has killed more than 500,000 Americans, yes, it's the SARS coronavirus type 2, but it's being facilitated by this defiance in science. And so it's death both by COVID-19 and death by anti-science. And this is globalizing. And I see this as a very potent force, as potent as anything that we've built infrastructure to combat, like nuclear proliferation or global terrorism. I think it's reached that status now. But I tend, for full disclosure, I tend to be an outlier here. This is my personal belief. I think most of the scientific community doesn't quite buy it yet, and certainly not. We're not seeing a lot of action happening in the Biden administration in terms of recognizing this as a threat, or the UN agencies. But I see this growing. Maybe it's because I go up against it regularly, and because I'm the lead target. Robert F. Kennedy Jr. on his Instagram labeled me the OG villain, the original gangster villain. So, Carrie, you're talking to the original gangster villain today on your
Well, I
Mother
have to
Jones
say,
Foundation. So,
I'm honored to be
right.
talking to the OG.
So maybe I have that, because I'm eating and drinking this stuff every day. Maybe I have a skewed perspective, but I think it's a very dangerous force and one we're going to have to contend with.
I wanted to return to something that you said just a moment ago. You called this anti-vaccine movement, the anti-science movement, an empire. Who's profiting off of this?
Well, I think it's so multifaceted now that you can't really point to one thing. I almost liken it to a crime family where you got one guy involved in extortion, one guy involved in money laundering, one guy involved in trafficking, one guy involved in drugs and narcotics. So it's got multiple different aspects. And, in some cases, you've got the Putin government and their motive is to destabilize democracies. Then you have these QAnon links, so it's become it's something tribal, something that becomes part of political identity. In other cases, you have the whole health and wellness industry, peddling fake autism cures and fake nutritional supplements. In other cases, if you go to Amazon.com and put in books up at the top on the website, like everyone has done, press return, and you go to health, fitness, and diet and click on that, then books on vaccinations. It's mostly fake anti-vaccine COVID conspiracy books. So you have people selling fake books and finding other ways to monetize the internet, getting hits, but it doesn't all quite add up. So if you're looking for and then there's actually donors, especially Republican Tea Party donors, but when you try to add up the money, it doesn't quite add up. There's still big chunks missing that I don't really understand where it's coming from. I liken it to when the astronomers and the physicists saw the galaxies accelerating. You couldn't account for it by the mass of the universe, so there has to be something else. So they invented dark matter and dark energy. So there's some kind of dark matter, dark energy thing going on that's also driving it that I don't quite understand, but it's very powerful and it's a killer. My premise is thousands of Americans have lost their lives, thousands of Europeans potentially as well. And now that anti-vaccine, anti-science empire, you're seeing it leach into low and middle income countries in Africa, in Asia, and Latin America. You're hearing about this now. So this is a serious problem that we have to address.
In addition to the anti-science movements, you write in your book about how climate change, human encroachment on animal habitats, and also political instability helps set the stage for new infectious disease outbreaks. Let's talk a little bit about climate change. How do you see warming temperatures contributing to the spread of disease?
So there's been a number of people have written about the role of climate change in disease. What my findings for the book are that, climate change is important, but it's also operating in concert with big social determinants like war and political collapse and deforestation and urbanization, now anti-science. So it's not climate change alone, it's climate change acting in concert with other forces. And one of the things I do in the book is identify about 6 or 7 hotspot areas where disease has been returning even before COVID-19. So in some ways, COVID-19 is a culminating event or a capstone event rather than something totally extraordinary as it's often portrayed. For example, you look in the Middle East or in the Arabian Peninsula, which is one of the chapters in the book, and it's from my experience as Science Envoy when I was there in 2015, 2016, and it was a tough time to be there because you had not only the Syrian conflict and civil war, you had the ISIS occupation that started in 2014, which had collapsed health systems and was bringing back measles and polio and a vector-borne parasitic disease known as leishmaniasis, often called the Aleppo evil because it causes disfigurement, especially among girls and women, and stigmatizes them. And then you had cholera come into Yemen with the proxy war between Saudi Arabia and Iran. So all those things were happening, but in parallel with that, you had 50 degree Celsius temperatures drying up ancient agricultural lands in that part of the world and causing people to abandon agricultural pursuits, move into cities, and that in itself was a destabilizing factor. So what you have is all of those things kind of feeding into each other at the same time. Another example is in Venezuela, with the Maduro regime. You've seen the socioeconomic collapse there, causing vaccination programs to halt. Measles came back in a huge way starting in 2017, just a year after Latin America declared itself measles-free. It came roaring back, and then you had people fleeing the country and going into across the border into Colombia or into Brazil, where they're coming into the Brazilian rainforest, coming into contact with Yanomami indigenous people, other indigenous people, and that measles caused a lot of devastation among those groups, and people people desperate for employment going into the illegal gold mining industry, where they're sleeping outdoors, being exposed to malaria, mosquitoes, so a several hundred-fold increase in malaria. And that's in parallel with a 40-year drought in the region. And undoubtedly, that's a precipitating factor. So it kind of looks at that and says, it's not only climate change, it's climate change is part of a perfect storm of a number of forces. And I even have Texas and the Gulf Coast listed there, not so much for political instability, or you could argue we've had some of that too lately, but it's more the fact that, if you look at Texas and the Gulf Coast, that's one of the important areas of climate change in North America, with warming temperatures, very aggressive urbanization in our Texas cities, and this rise in anti-science, and it comes together in that way as well. So, and one of the side themes of the book is the fact that I have an MD and a PhD. I never, in my medical and graduate training, I never had a lecture about shifting poverty and war and political collapse and urbanization and climate change. These are not things that in the biomedical sciences we think about, and it says, well, maybe we should. Maybe we need to have better dialogue between the different disciplines in order to solve what are becoming multifaceted, multidimensional problems. We have to embark on this uncomfortable dialogue with anthropologists and political scientists and economists and people in the humanities, because these problems are multifaceted, and just focusing only, and I'm a vaccine scientist, focusing, yes, the vaccines are important, but it's how we use the vaccines, how we negotiate them and use them as instruments of foreign policy are as important as the technologies themselves.
Well, and that's, I guess, a return to the idea of this vaccine diplomacy. And it makes me wonder, we're hearing now that while the United States is on track to make COVID vaccines available to everyone here by next month, we're hearing that in other countries it might be years until people have that kind of access. What happened? Did the United States just hog the whole world supply?
Well, I think there was a couple of things. I think when the big donors were looking to support vaccines, right off the bat, there was a problem that still has not been widely acknowledged. They went very heavy on innovation. Innovation was the top priority in some ways, and they wound up producing very interesting vaccines, like the 2 mRNA vaccines from Pfizer and Moderna, and the adenovirus-based vaccines, and the protein particle vaccines. But those vaccines had never been scaled before, never been produced at scale. And the consequence was the companies could produce just enough for North America and Europe. And then if something were left over for low and middle income countries, great. So it's not that there wasn't a good faith effort to try to ensure equity. I think, the WHO and Gavi, the Gavi Alliance, and CEPI worked together to create this COVAX sharing facility, which is brilliant in its design. The problem is the vaccines aren't there to provide to the COVAX facility because they can't be scaled at the level we need. I mean, I think it's almost as if nobody took a step back and realized, hey, we're talking about 1.1 billion people in sub-Saharan Africa and 650 million people in Latin America. It's 3 to 4 billion doses. There's just no way you're going to do that with the mRNA vaccines, and maybe even some of the adeno or protein particle vaccines. So early on, I pushed very hard, but kind of lost that battle to say, look, get some of the oldies but goodies in there. Get the traditional technologies, like our recombinant protein vaccine that's been used to make our technology's been used to make hepatitis B vaccine for 35 years, and you can make a ton of it. But it didn't have that innovation factor, and it wasn't very interesting. So it's amazing. That whole beginning, a year ago at this time, Kiera, I was on the phone with donors desperately trying to raise money so I could transfer the technology for our COVID-19 vaccine to a developing country vaccine manufacturer. So fortunately, some of the local foundations here in Texas came through. The Clayburgh Foundation came through in a huge way for us. They're based here in Texas. Tito's Vodka came through for us. So if you, I don't know if you drink alcohol, but if you do and you order and you have a cocktail tonight and it has vodka, it should definitely be made with Tito's Vodka. And the JPB Foundation, a few others. So we were able to raise, $3 or $4 million, and that's what we needed to myself and my science co-partner for the last 20 years, Mary Elena Batazzi, we had this group at Texas Children's Hospital called the Center for Vaccine Development. It's part of our National School at Baylor College of Medicine. We were able to, develop the process for that, and then we were able to work with Biological E in Hyderabad, which is an incredible track record for mass producing vaccines, and now it's there. So we're able to show in non-human primates. It gives great protection in collaboration with a group at Emory University, and now they're scaling up production and it's finishing phase 2 trials. And the hope is that will, and now, the policymakers, CEPI has come through with the Coalition for Epidemic Preparedness Innovation has come through with support, urgently needed support, and the Biden administration announced they're going to now support Biological E. They're also making the J&J vaccine. So I hope now we can come through and make a contribution to what's going on in Africa and Latin America. Otherwise, I'm worried because we know what happens if we only vaccinate the United States, the UK, and Western Europe. That's not going to go well because this virus will continue to circulate. We'll see more and more variants, and it'll be a humanitarian catastrophe. So far, Africa has done reasonably well, we think, with COVID-19, but now with this B1351 coming out of South Africa, now going into Malawi and Mozambique and Tanzania, I'm really worried about Africa, and I'm really worried about Latin America with the P1 variant. So I'm hoping ours can come in and make a contribution.
It's great to hear that you're working on greater access for people around the world. We also have an equity problem here in the United States. It's becoming clear that while we're making great strides in the vaccine rollout, some Black and brown communities are still being shut out. Is there a way to apply the concept of vaccine diplomacy here in the United States, or maybe if not vaccine diplomacy, then just a greater focus on equity?
Yeah, and I've been thinking about this for the last couple of decades. So one of the things that I did when we moved to Texas a decade ago, I came from Washington, D.C. I was chair of microbiology at GW, which I loved. But, I thought I knew what poverty in America looked like. Then I came down here to the Gulf Coast, and it's a different animal. There's a depth and breadth of poverty here in the Gulf Coast states that I think not many Americans know about. In fact, the UN Special Rapporteur for Poverty visited here in 2017 and began talking with people like Catherine Coleman Flowers, who's an environmental justice activist working in Alabama, and looking at some of these places here in Texas and elsewhere. I said, this is as bad as anything I've seen. I'm sure there are parasitic infections here, neglected tropical diseases, which is a term we helped coin in the early 2000s. And as we began looking, we always found them. And it's just that they're a bit off the beaten track and hidden from view very often. But I estimated there's about 12 million Americans living with a neglected tropical disease. And what the interesting part of that was having so much success as an advocate for neglected tropical diseases in Africa, Asia, and Latin America. I thought, when we find them in the U.S., this is going to be easy. Then this thing will really blow it open and get people to really care about it. But the opposite happened. It's much tougher, I've found, to get people to care about diseases of the poor in the United States than anything we've done in low and middle income countries. And I still don't understand why. I mean, fortunately now we've been able to work with Senator Cory Booker's office and Chris Smith, who's a Republican member of the House of Representatives in New Jersey, and people like Hank Johnson in your area, who's a member of Congress, to start filing legislation. But once again, when COVID-19 hit, one of the things that I first saw was this was decimating Hispanic neighborhoods here in Houston, and that was also really hard to get people to care about it, because what we were seeing in the Hispanic neighborhoods and the African American neighborhoods was the people who were dying were at a much younger age than what we were seeing otherwise. The narrative that's out there, this is an illness and a killer of people over the age of 65. Well, the numbers out of the CDC, about 30 to 35% in Black and brown communities and Native American communities included, are under the age of 65. So this is a killer of, moms and dads and brothers and sisters in their 40s and 50s. And that was a hard message to get out. Finally, Representative Escobar from El Paso, and I was talking a lot with Beto O'Rourke all in 2020 about this, in some cases with Andy Slavitt. These were good guys that really helped, cared about this issue. And then people like Sylvia Garcia and here, and Sheila Jackson Lee and others really listened very carefully. I was able to testify to the Congressional Hispanic Caucus, but it's still a tough message that people don't seem to want to hear. It's an inconvenient truth about how, in my opinion, this has been decimating Hispanic and African American communities all year, and that was one of the reasons why I was so out there, debunking the disinformation campaign that came out of the Trump administration and around this time last year, and because not that I was one of the first to call it out, not because I'm so brilliant, but because for years, decades, I've been going up against the anti-vaccine disinformation. And so I've learned to know and smell anti-science disinformation campaigns a mile away. And I saw this unfold, coming out of Peter Navarro in the White House and Larry Kudlow, and you had Kayleigh McEnany saying that hospital admissions were elective surgery. I said, I know what this is, and was one of the first to call it out. And that was very tough for me because, the message as a scientist is, you're not supposed to just stick to the science, Peter, just stick to the science. You're not a political guy, just stick to the science. And finally, my wife, Ann, saw how upset I was getting. And she said, look, if you don't want to wait till next year and you see the number of people who've lost their lives from COVID, and especially in Black and brown communities, and not say anything, you never forgive yourself. So that's what I did, and it took me to a very dark place that I'm still going through, and it's very tough to go up against the White House, and I'm glad I did it, but I'm still feeling the effects of it.
I can imagine. So some scientists are already warning about the next pandemic. After this whole ordeal of COVID-19, are we prepared?
Well, one of the things that I say, people say, well, you know what, why do we never learn? And we have actually. If you look at what happened after SARS in 2003, the original severe coronavirus, severe acute respiratory syndrome, we put in place international health regulations 2005. After H1N1 and the pandemic flu in 2009, we put in place a global health security agenda and increased our flu surveillance. And after Ebola in 2014, and the success of that Ebola vaccine coming out of Merck and Company, which was incredible. It really helped stabilize the African continent. Then, the global policymakers met at Davos in 2016, 2017, and created CEPI, the Coalition for Epidemic Preparedness Innovation, which is helping to support vaccines. So we do learn. It's just that it's sort of piecemeal and incremental. And the question is, what do we need to do next now? And I think for me, and I wrote about this in the Los Angeles Times, I think we need to build in self-sufficiency for making vaccines. Right now, no vaccines are made in the African continent. Not Latin America underachieves, the Middle East doesn't. We need to build in that infrastructure, not relying on the multinationals to produce all of these fancy vaccines that can't be scaled. I think that's one lesson learned. I think another is a greater role for the G20 countries, because if you look at the countries that put up a financial support for global health, it's the U.S., it's the Nordic countries, it's the U.K., the Gates Foundation. Now India, of course, is doing extraordinary work in terms of their contributions. But we need the full G20 nations to provide that support. So great. This needs to be a priority for the G20 summit, and China needs to step up in a bigger way. Japan started through their GHIT fund, but it needs to do more. South Korea is doing some through their Right Fund, which I'm connected to, but needs to do more. So that's another big piece. And then finally, I'm of the opinion, as we talked about earlier, that we've got to do something about the anti-science empire. It's enough. It's just too damaging, and it's getting out of control, and it's leading to loss of life on a large scale, and arguably more than any of the other things that we build infrastructure to combat.
Well, that's all we have time for today. Dr. Hotez, thank you so much for joining us.
Well, Kiera, you've been, as I say, you and Mother Jones have been great all year 2020 and 2021 and giving attention to these issues. And I really do appreciate the opportunity to do something in a longer format than what I usually do, because, sometimes these what I'm talking about doesn't fit into a 30-second UNICEF commercial. You need the time it takes some nuance, and so it means a lot that you gave me the chance to do this.
Well, we really appreciate your unpacking it for us. It's been such a fascinating conversation. Viewers, if you want to watch this again, we'll be reposting this conversation on the platforms where you're watching now. And we'll also put out a version of it on the Mother Jones podcast. For more health and science coverage, you can visit motherjones.com. I'm Kiera Butler with Mother Jones. Thanks so much for tuning in.